So thank you all for joining us today in a CareMessage and NAFC joint webinar where we are discussing how best to support underserved communities of color during COVID-19 through strategic text messaging. On the agenda for today, if you don't already know who we are, I will introduce CareMessage, and we'll also hear from Ariana, the Director of Strategic Initiatives at the NAFC, and Jody, who is the Executive Director of the Texas Association of Charitable Clinics. We'll also give an overview of health disparities, considerations for engaging with your patients, and a demonstration of the CareMessage platform. We'll also have time for Q&A at the end. And if a question pops into your head, please feel free to use the Q&A feature within Zoom. And if you have a question for a specific speaker, please also do include that. We will be recording the session and we will send it out to you to share with anyone in your network that you think might find it valuable. And before we go any further, I did want to note that while I am presenting this information today, Orit Mohammed, who is a product manager here at CareMessage, put together all of the research and information that I'll be referencing. So a special thank you to Orit. And I think that's pertinent when we explain who we are as an organization, because it goes to show that the folks like Orit that are actually responsible for designing and creating the platform itself are very much in touch with the larger picture around who we are creating this for. So a brief word about CareMessage. We are a nonprofit organization whose mission is to leverage technology to help safety net organizations fulfill the essential needs of underserved populations. In short, CareMessage is a patient engagement platform built especially for safety net providers and their patients. We work with over 100 free clinics across the country and over 200 organizations in total. Our focus lately has been on addressing the disparities that exist specifically for patient communities of color. And with that understanding of who we are, I will turn it over to Ariana.
Hi, everybody. Thank you so much for having me. That I appreciate the intro. I'm pretty excited about this webinar. I think it's going to be just so important, so educational. But I wanted to quickly just, thank everyone again for being on here today. And thank you for joining us for this important conversation that's specifically really looking at the underserved and communities of color and how we are connecting with them with such a resource. Now, just to give a little bit of background information, I did want to share with you all that the National Association of Free and Charitable Clinics, we represent all 1,400 plus free and charitable clinics and charitable pharmacies in the United States. And so a big part of that is being able to connect and create different partnerships at the national level to be able to assist and really advocate for and support free and charitable clinics in every state. With the pandemic that has occurred to all of us and is impacting each and every one of us, one of the things that we created was we have an entire webpage with different resources that are related to coronavirus that may be able to help not just the clinics and pharmacies, but the patients and such. And so, we want to make sure that we are connecting all clinics and pharmacies to resources that they may need, whether it be a telehealth solution, whether it be a PPE burn calculator, whatever it is, we really want to make sure that we are able to find these resources for you. So one of the big resources that we had was one of our partnerships is with CareMessage. Now, the NAFC has actually had a partnership with CareMessage for a number of years. And we have worked together on a number of different projects with CareMessage to really bring this increased connection between patients and their medical home. Because, it's important. It's important to not just have a visit, for a patient to be able to see a provider, nurse, and then go home, but be able to have that extra touch, right? Be able to really reach and provide that extra outreach to your patient population. And so we do believe that it's very important, it's vital, honestly, for our clinics and pharmacies across the nation to be able to go a little further and connect with those they are serving. You know, at the end of the day, free and charitable clinics are a grassroots movement. And so they understand their communities, and what a great resource to be able to understand those that are left behind, to be able to truly connect with them a little bit more. And so this is why we thought that it was just such a great opportunity for leaders such as those at CareMessage to be able to give a little bit more of a perspective on how are you reaching communities of color, especially during a pandemic like this. And so we couldn't be happier with this kind of partnership that has been truly supporting our clinics, truly helping them, and being able to help them connect with their patients, because it's not just about no show rates. It's not just about that, but it's about really connecting with those that you serve. So we couldn't be happier about something like this, and being able to delve in a little deeper into how these clinics are using a resource like CareMessage, how different parts of our patient population are being affected, and how we can maybe help remedy that, how we can, in our pursuit of health equity, reach a little further, as I mentioned before. So again, I want to thank you all so much for being here, and I want to thank truly CareMessage for the opportunity to bring about just one more great method to be able to connect truly with our patients and our communities, because our clinics and our pharmacies really are the community's response. So with that, I would like to take a moment and hand it over to one of my colleagues, one of my honestly favorite people in the world. I'll hand it over to Jody Hopkins, who's with the Texas Association of Charitable Clinics. Jody?
Great. Thank you, Ariana, and thank you, Thad. I just want to take a few moments to kind of share some of the experiences that we've had with CareMessage in Texas. We first introduced the platform to our members back in 2014, so we also have been working with them for a while. And when clinics first began using this, it was used a lot for kind of appointment reminders, your medication is ready, which they found extremely useful. But as time has gone on, they've really expanded it to much more than that. We had a clinic that when they first began using it, their no-show rate drastically declined from about 14% to about 5%. But what they found was also equally as important was some of the health education that they were able to send out. Many of you are working in clinics. It is not surprising that you might have a diabetic patient that doesn't really have very good control. And so this particular clinic worked with this patient, and they came up with a schedule that the clinic was going to text him on a daily basis when it was time to take his insulin and to check his fasting blood sugar. And they both committed, the patient and the clinic, to do this for like 2 or 3 weeks in a row every day. And at the end of it, the patient had really stabilized their condition, as well as really gotten himself on a schedule, and he's continued to maintain that schedule. So they've really done a good job, I think, the clinics, in really expanding how they're using it. And then, of course, currently along came the COVID pandemic, and communication with patients was essential. And, you know, a lot of clinics broadcast things on social media. A lot of them, you know, went up and put notes on doors, and just tried any way possible to get messages to patients. But what we found really worked, again, was using the CareMessage platform. So they have really expanded it to not just send out messages like our clinic is decreasing hours, or, you know, here's when you can come pick up your meds, but they really turned it into kind of part of another model of services that they can provide to their clients. So for example, we have one clinic that was doing Zumba classes, and obviously that's no longer possible. So the woman who was doing the Zumba classes recorded them and then sent out a link via care messages. So the clients at their own pace and their own time could watch those and continue, with kind of that physical fitness. I really liked what one of our clinics did in Galveston when they were trying to kind of convert to telehealth. They sent out kind of basically a survey through CareMessage and said, these are the platforms, Zoom or FaceTime or Duo or Skype. Text us back which one you want to use. And so they were able to do kind of a point in time survey as to what was going to be impactful for their clients. We've had others that have used it for standard just health messages. One person, only one person in the exam room at a time because of what's going on. What's the number one thing you can do to stop the spread? And then another one of our clinics really personalizes it. They always use their name. It's kind of the nurse that they know at the clinic. So when they text out their message, they say, hi, this is Jody, and I want to let you know, and then give some kind of health information. So we have found it very helpful, and our clinics use it a lot. I had Thad pull some numbers for me for the last 3 months in 2019, and it looks like we had an average of about 13 to 14,000 messages a month from our clinics, and I am guessing that has even probably increased in 2020 with everything that's going on. So I kind of just welcome you to, as you hear about the platform, to really think broadly about the different ways it can be used, because here, at least here with our clinics in Texas, it's really been a neat kind of evolution to see them start to use it for maybe fairly simple things, and then to really expand it out again to almost be like a whole new line of service for their patients. So thanks for giving me those few moments to kind of share what's going on down here.
Thank you, Ariana, and thank you, Jody. I'm glad you brought up some of the numbers there. Fun fact, since the onset of COVID, the free clinics in Texas have delivered over 200,000 instructional messages to their patients, which is far and away the most activity we've seen from one state among free clinics. And that's due in large part to Jody's leadership. So thank you very much. I want to talk briefly about something you all are likely aware of, but I do think it's important to note that the social determinants of health are responsible for many of the health disparities that we see across the country today. Where we grow, live, work, and age all have an impact on our health. Our health is determined in part by access to social and economic opportunities, the resources and support available in our homes, the quality of our homes and neighborhoods, the quality of our schooling, the safety of our workplaces, the cleanliness of our water, food, and air. These are all conditions that impact our health and explain why some Americans are healthier than others. So, within that framework, let's talk about why certain communities are disproportionately impacted by a set of social determinants that are detrimental to their health. I think it's really important to state that systemic racism plays a role in who has access to health, who stays healthy, and how long people are allowed to live. I want to share some statistics that highlight how communities of color are disproportionately impacted by health disparities. A study by the CDC showed that Black people are more likely to reside in inadequate housing where exposure to toxins and other environmental hazards are high. The diabetes death rate from 2014 to 2017 was highest among non-Hispanic Black adults and lowest among non-Hispanic white adults. Non-Hispanic Blacks had the highest age-adjusted prevalence of obesity, followed by the Hispanic community. Black people have a higher risk for hypertension and hypertension-related complications, strokes, diabetes, and kidney disease. Childhood asthma is directly linked to living in historically redlined neighborhoods, and this is a topic that we will be exploring in the next slide. But racial segregation, racial prejudice, legal and illegal discrimination are all factors that have negatively impacted the social determinants of health for communities of color, which lead to the health disparities that we see. So, to further illustrate the relationship between structural racism and health, we'll be talking through asthma as an example of how communities of color are disproportionately impacted by a set of social determinants that ultimately make them less healthy. Racial segregation was normalized and legal in American society and meant that separate towns, hospitals, and jobs existed for white people and black people. Often referred to as the Jim Crow era, racial segregation became deeply entrenched in the fabric of our country. Segregation in schooling was deemed unconstitutional in 1954, but many of the Jim Crow era laws persisted until 1965. Racial discrimination in housing in particular progressed, as did racist values. Redlining is a term used to describe a set of discriminatory housing policies that led to starkly segregated neighborhoods. After the Great Depression and the rise of mortgage loans and housing policies that helped build the American middle class, the federal government created color-coded maps that told banks where they could and could not give out housing loans. The red sections where black people lived were deemed too risky. Ultimately, black folks seeking mortgage loans were unable to receive them, which lowered the property value in those neighborhoods. Redlining was deemed illegal in 1968 under the Fair Housing Act. However, racial discrimination in mortgage lending persists today. Some banks have used redlined maps as recently as 2015. So ultimately, this left black neighborhoods extremely resource deprived, and property value is tied to a number of social determinants of health. Many of the same neighborhoods that were redlined in the past are still majority black and brown neighborhoods and have generally poorer air quality. Majority black neighborhoods are more likely to be located near sources of pollution. Historically, redline neighborhoods also exhibit much higher amounts of diesel particulate matter in the air. The communities who are forced to live in these neighborhoods deal with higher rates of asthma. This is a pretty clear example of how large a role racist policies and practices play in impacting the lives and wellness of our communities. We also know that respiratory conditions such as asthma make people more susceptible to COVID-19, which explains why we see such disparities by race. As free clinic providers, I'm sure you are all aware that the communities you serve are vulnerable to this virus, right? COVID-19 is highlighting and revealing much of what we already knew about health disparities, but in an increasingly drastic way. A few examples here. In Louisiana, the Black community makes up 32% of the state's population, but account for 70% of COVID-19 deaths. With regard to the Native American community, members of the Navajo Nation make up just 5% of Arizona's state population, but account for 20% of COVID deaths in the state. In New York, members of the Latinx community are dying at a higher rate than any other group, making up 19% of the population, but 25% of deaths. So we've addressed here a lot of the historical, structural, and social forces that impact health disparities. We now want to spend some time outlining some considerations for engaging underserved patients. First is the lack of infrastructure for telehealth, whether that be cell phone service or access to wireless internet. This graph here illustrates how attendance of appointments actually decreased after telehealth implementation among Black, Latinx, and Asian Pacific communities. Comorbidities seen at higher rates within communities of color include diabetes and obesity, screening rates. There's also a fear and lack of resources for undocumented and mixed status families. Language barriers for non-native English speakers or those with limited English proficiency. And treatment options and availability. This is really where we see free clinics stepping up, right? Making treatment available to those that may have otherwise gone without. A large part of engaging communities of color is acknowledging the unique challenges of patients from various racial and ethnic backgrounds. Although many safety net patients do share experiences due to their income, it's important to acknowledge that intersections exist between income and race and ethnicity. So, some things you can do include preparing a tailored communication strategy for different subsets of your patient population. You can also provide support for underlying conditions like diabetes and obesity, especially in the form of patient education. We also recommend preparing patients for a transition to telehealth. We created a few videos, informational videos. Our co founder and VP of product, Cecilia, created these videos actually in both English and Spanish, explaining telehealth to patients. You can access these videos for free on our YouTube channel or by visiting the first link listed here. Additionally, you can direct your patients to existing resources for things like rent, food, medication, and financial assistance. We created a messaging library at the second link here that is chock full of sample messages and resources. Text messaging is the most accessible tool that you can use to reach patients. It breaks down barriers that exist for patients of color regarding access to health related information, which is more important now than ever. Within the Black community, mistrust is a major barrier. Opportunities here include advocating for Black patients when they walk into your health center and share what symptoms they're experiencing, and also have discussions with your team about implicit biases in healthcare. For a Native American community, the Center for American Indian Health has developed COVID-19 materials specifically for tribal use. And within the Latinx community, be sure to provide information in Spanish and send out resources for immigrants as well. Just a bit of housekeeping here. We will be sending out a link to these slides after the webinar to make it a bit easier to reference all of these links and resources. I know there are a lot here and more to come. So, in response to COVID-19, we felt that we would be most valuable in providing support to safety net providers. So we created an interdisciplinary task force, established partnerships with both NAFC and NAC, which is the National Association of Community Health Centers. We quickly put together a library of COVID-19 messaging content in both English and Spanish and shared that out to anyone who could make use of it. We also rolled out a more lightweight version of our full product, what we call CM Lite, to any safety net organization for free for at least 60 days. So altogether, they've messaged over 1.4 million patients that previously were not receiving information about COVID via text message. Included in CareMessage Lite are the core features that are most important right now. The first is outreach, which allows you to send information and resources to large groups of your patient population or all of your patients simultaneously. The second is Messenger, which allows you to engage in one-on-one communication with your patients about any topic that you'd like to address. It's a great way to check in on a specific patient or household and have a much more personal conversation. Groups allow you to segment your patients to more easily reach out to that specific cohort. So if we wanted to share the Center for American Indian Health materials with our Native American population, we might first want to create a group within CareMessage. Our file center allows you to upload a large list of patients to CareMessage with a basic Excel spreadsheet. Text messaging is a great way to share existing resources with your patients and provide them with social and emotional support. It's highly accessible for low income populations, and we've shared some of the most common messages we've seen clinics send in the library that I mentioned previously. One of the ways that we've seen CareMessage being used lately, and Jody mentioned this briefly as well, is for collecting information from and disseminating to your patient population. Since we know that communities of color are less likely to show up to telehealth visits, effective communication around the logistics is important. In this example of an outreach message, we are surveying patients to better understand their needs. We want to know if they have the ability to attend a video appointment, and if so, we then want to make sure that we are providing them with proper instructions on how to prepare for that appointment. In this case, we'll insert a link to a website or a video that walks them through that process. If they opt for a voice call, we'll know to simply give them a call at the time of their appointment. So with that, I will go ahead and log into our demonstration CareMessage account for an overview of what the platform actually looks like. So this is taking me just to caremessage.org, and you can see in the top right-hand corner there is a login button. And what's nice is that this is a web-based platform. So there is nothing to install or download, and it's accessible from any computer, whether you're in the clinic or you're at home. So I'm going to go ahead and sign in here. And the first thing we'll see is just a dashboard of the patients that you have and have not been engaging with recently. On the left-hand side here is our navigation. The patients is simply a list of the patients that you have loaded into CareMessage that you can send text messages to. Within the patient profile itself, you can see their phone number, their language preference, and you can also see the features in which they're enrolled. Groups I had mentioned previously. This is where you are able to customize the groups of patients that you'd like to message. So I had previously mentioned the Native American population. We might want to deliver some specific information there. You can see a brief description of the group itself and the members within that group. I also have a few examples here. We have a group for our diabetic patients if we want to deliver specific health education around diabetes. And we have a group for folks that are overdue for prostate screening. So maybe we want to deliver a message to those folks specifically as well. The file center, as I mentioned, is where we are able to upload patients and create groups en masse. I'm going to hop down to the outreach feature, which we had mentioned is able to send a message to a large group of patients or to all of your patients all at the same time. We have a number of templates that come pre-loaded into your CM Lite account, including a number of COVID-19 specific messages. So we would be able to take a look at, let's check out the telehealth survey. All right. So we clicked on this template, and now we're able to see the message in both English and Spanish. We can see that it's a multiple choice type question. And for each response, either A, B, or C, we're able to provide more specific details or instructions. So this is how we are able to survey our patients to see which platform they might prefer. Jody had a great example where they presented their patients with a number of options, either Zoom or Duo, FaceTime, Doxy, things like that. This is a bit of a simplified version of that, essentially asking if folks prefer a simple telephone call. Maybe they don't have great Wi-Fi and they don't wish to engage in a video call. That's fine. We'll know to call them at the time of their appointment. But if folks do indicate that they would prefer a video call, in response, we can provide them with, in this case, the video that Cecilia created to explain how to use the telehealth service that you have implemented. So if we wanted to use this template, we would just simply click on Use This Template up there in the top right-hand corner. We can select the patients from our patient list. In this case, this is applicable to everybody. So we can go ahead and select all of our patients, save those changes, and you can see all of the information is pre-filled out here. If you wanted to make any changes to the language or plug in a different link, you could certainly do that here as well. We want to make sure that both English and Spanish are always chosen so that it is delivered in the language that the patient prefers. You can see here that you can add an additional response. You can remove the last response here. So as Jody had mentioned, you maybe want to include a number of telehealth options, and we can certainly do that here as well. Then we'll simply plug in a date and a time for the message to be delivered, and we would go ahead and hit create. That will schedule this message to be sent ahead of time. Once it is sent, we would be able to go back to the outreach feature and see a list of the messages that we've delivered to patients in the past. You can see the number of patients, the response rate, and if we click into this telehealth survey specifically, you can see that I indicated that this was for patients that had an appointment between May 1st and May 15th, right? So we want to survey that specific group of patients. Again, you can see how the metrics shook out here, how folks responded. In this case, we had 3 folks each responding with one of the options. And when we click on patients, we're able to dig a bit deeper and see exactly how each of our patients responded. If they respond with a question or they're looking for clarification, that will also be flagged, and we can use the filters at the top here to view only responses that require some sort of review, and maybe they require us to then go ahead and reach out to them directly, and we'll talk about how we can do that as well. In this case, we can see that this particular patient responded with C, that she doesn't mind either a voice call or a video call. So in that case, we delivered the link to show her how to get set up for her telehealth appointment. Now, to take this to its kind of logical end, right, we might want to follow up with Caitlin and deliver to her a link to her telehealth appointment, right? Maybe an hour beforehand so that she can get used to it, or maybe we want to deliver it 10, 15 minutes before. Either way, the best way to do that would be to use the feature that we discussed previously, Messenger. This is a direct message between you and your patient, or between a provider or a case manager or a nurse or whomever and their patient. So in this case, I am sending a direct message to this patient saying, hey, this is Thad from the CareMessage clinic. I'm going to send you a link to click on 10 minutes before your virtual appointment tomorrow, right? We see a response come back in there from Caitlin, and then we follow up on that right before her appointment. We say, here is the link to join your Zoom video appointment. Please click on the link 5 minutes before your appointment begins, and we deliver that link to them. So it's important to understand the kind of interplay between the features, right? We send an outreach message to a large group of folks, surveying them about their telehealth preferences, and then we get more granular, right? We deliver a message to a specific patient that is unique to them. So it's creating this much more personalized engagement experience. And like Jody had mentioned as well, I really do like when we see folks using, the provider's first name. So I said, this is Thad from the CareMessage clinic. Now we know, or now the patient knows that it is actually a person on the other end that's sending them a message. And that brings us to the end of the demonstration. I want to thank you all for taking time out of your day to join us for this discussion. We are hosting a number of subsequent webinars that dive deeper into social determinants and what they mean for underserved patient populations. So keep an eye on your inbox. And if you found this session to be valuable, we certainly encourage you to share it with your network. Thank you all once again, and we will open up the floor for Q&A. If you have any specific questions, you can click on the Q&A button in Zoom and ask away. Jeremy, were there any questions that came through during the presentation? I will go ahead and switch over to the frequently asked questions slide.
Yeah, the only question that came through during the presentation was that one that you addressed about whether or not the slides would be sent out afterward. And then to your point, to restate that, the slides will be sent out to all the attendees afterward. But if any other questions do come to mind, feel free to post in the Q&A or in the chat and we'll address them.
Thank you. Yes, we will absolutely share this out with everybody once we're done, so you can click on the links.
So Thad, we have a question from Alexandra just asking, what is the cost of CareMessage? And I think this is something you can address.
Yeah, absolutely. Thank you for the question, Alexandra. Right now, CM Lite, which includes the two features that we talked about, Outreach and Messenger, is available for free for at least 60 days. So you can simply go to caremessage.org. You can fill out a short form, and we can get your account up and running in 24 hours generally. So you're able to utilize it immediately. You can use the two kind of core features that we talked about today. And if you're interested in pursuing the full platform, which would include our appointment reminder system, it also includes our 19 different health education programs that are all delivered via text message. Then that is a discussion we would have at the end of that period of time. The fee structure is based on a sliding scale dependent on the annual operational budget of your organization. So the idea there is to make sure that it's affordable for each and every free and charitable clinic. So I would certainly encourage you to explore the website, fill out the form. We can get you up and running with a CM Lite free account. And from there, we can explore the pricing depending on your organization's budget.
Thank you. So we have another question from Ariana here, wondering how long our contract periods are.
Yeah, that is something we've typically done, just year-long contracts. But we're certainly open to longer agreements as well. We want people to stick around with us for as long as possible. So yeah, we in the past have simply done year-long agreements. It's a flat rate, again, depending on your budget. The tiers and fee structure looks very similar to the NAFC's tiers. But yes, it's a flat rate, and there's no per patient cost. There's no limit to the number of messages that you're able to deliver. We don't want to limit that in any way. So it's always going to be a flat fee. And yeah, like I said, we've really only done year-long contracts, but we want people to stick around for longer than that. So we'd certainly be open to longer contracts with folks. Thank you for the question, Ariana. And if anybody is interested in discussing this further, you can always reach out to me directly via email. I'm happy to have some of these more specific conversations with folks.
All right, and we did have one more question just come in, wondering whether or not CareMessage is HIPAA compliant.
Yeah, good question, and obviously top of mind when we talk about technology solutions in the healthcare space. Yes, our servers in which your patient data is stored are all HIPAA compliant. We work strictly at this point with healthcare organizations, so we know how important that is. The thing that we need to consider is that SMS or text messaging is not inherently end-to-end encrypted. So while we may not want to share lab results with folks over text message, we can certainly text them to say, we have received your lab results. Could you give us a call to discuss further, or something like that? And essentially, by providing you with their phone number, patients are opting in to you delivering to them information about their health. So it can be general healthcare tips, that can be appointment reminders, that can be checking in on folks through the direct messenger to see how they're feeling. But it is important to be cognizant of what can and should and cannot and should not be shared via text message, which we have lots of literature around that. Thank you for the question.
If anyone else has any questions, again, feel free to send them into the chat.
Yeah, thank you. If there are not any further questions, we can wrap this up. If something pops into your head and you are interested in speaking with me further or learning more about CareMessage, I would definitely implore you to go to our website, but also to reach out to me personally via email. Again, it's just going to be thad@caremessage.org. I'm more than happy to have conversations with folks. So yes, thank you so much. Current users, I see a question here. The number of patients it recently has skyrocketed. I want to say, and Jeremy, correct me if I'm wrong, if you have knowledge of this, but I believe that we've recently, in the most recent month, have reached 4 million patients. We have over 200 health centers, whether that be free and charitable clinics or community health centers. It's around 200, just over 200 folks that are using it across the country. And I apologize if that didn't answer your question specifically, but please do, like I said, feel free to reach out to me and we can have a conversation about that.
It looks like Bev just clarified that she's wondering if there are any other NAFC facilities using CareMessage currently.
Well, there are certainly a number of NAFC free clinics that are using CareMessage. Lots of them. But yeah, I will unmute Ariana if you wouldn't mind providing a little bit more context there, maybe.
Sure. Thank you, Thad. And thank you for that question. Yeah, actually, a large number of free and charitable clinics in the nation actually use CareMessage and have been using it for years, which I think is something that I find very interesting in terms of how have you used it in a different way with in the, in the past 3 months or so. I think that would be interesting to see, but there are a number of free and charitable clinics and NAFC members that have been using CareMessage. If anybody is interested with connecting with any of them, please reach out to the NAFC. We would be more than happy to connect you, or Thad, you and I can also chat and see if there are any, all-stars that have been using the system for a long time and are good people to connect with. So you can always contact us and we'd be happy to connect you, of course. One of the things that the NAFC has done in the past with different items, such as a specific EMR system, for example, is we've had members ask us to create listserv groups specifically for them. For example, we've had members ask us for a listserv group for Athena Health users, or a listserv group for Practice Fusion users. So if CareMessage is one of those points of interest that our members would like us to create, please know that we're always happy to have that conversation and see if that's something that you guys would like. But just wanted to throw it out there that if you do want to connect with other members that are using CareMessage, just to get kind of insider's view of how has this helped you, how have you used it specifically, because we know that you all use it may use it for different reasons or in different ways depending on your patient population, your community, and how it works best for your organization. So we're always happy to make those connections. And Thad, you and I can chat later about how we can kind of tag team on this if this is something of interest. But just to kind of answer that question, there are a number, and I can probably come up with a number. I'd probably look into it with our annual data survey, but I would say that there's a pretty large number of free and charitable clinics that are part of the NAFC that are using CareMessage presently. We have worked with CareMessage on a couple of programs in the past where, for example, we had a program that was funded through the Cardinal Health Foundation that allowed for clinics in the state of Ohio to use CareMessage for that patient interaction and patient connection. So we have a number of clinics in the state of Ohio, just as an example, that would be more than happy, I'm sure, to chat with anybody who's interested in getting kind of that peer perspective. So happy to help in any way. Please feel free to contact us directly, and happy to do that. Happy to share, and make that connection and be a good conduit. Or if there's anything, Thad, with CareMessage that you guys would like to, we can definitely brainstorm and see how we can help.
Awesome. Thank you so much. I appreciate you filling in some of that context. Aha, okay, yeah, so it looks like Bev was asking about the results of an annual NAFC survey. Looks like that's going out today, so awesome. Jeremy, is there anything else left in the Q&A that we might have missed?
Nope, it looks like we've addressed everything that came in. If any last questions are on anyone's minds, feel free to add those, but otherwise I think we're all set.
Awesome. Okay. Well, thank you all so much for taking the time. I really do appreciate it. If you have additional questions, you can reach out to myself at thad@caremessage.org, or you can reach out to our support team, of which Jeremy is a part, and that is support@caremessage.org. Thank you so much. I really appreciate everybody's time. Thank you to Ariana and Jody and Jeremy for helping out. Thank you, and take care.